So I'm gonna interpret it like in the typing the in chatting room. So
okay, do you want me? Should I start?
yeah, you can start it. Yeah.
Great. Okay. Well, good afternoon, everyone. My name is Mark Ashton, and I am the admissions tutor here at Newcastle University, where I look after admissions in the School of Pharmacy. So I have a relatively short presentation to give you an overview of what you could expect from living in Newcastle upon Tyne, and then more broadly what you could expect if you study pharmacy with us here in Newcastle. So I guess a good place to start is really, where is Newcastle upon Tyne? Well, it is the regional capital of the northeast of England. So you can see on this map, we are right up near to the Scottish border. So it is approximately, it's probably 100 miles from Newcastle to Edinburgh, and about 50 miles from Newcastle to the actual border with Scotland. You can see that the city is very well connected by plane to London, Amsterdam, Paris, Dubai. So all of the sort of regional hub airports are all well connected to Newcastle. So, for example, a lot of students that we have in Newcastle use the Dubai route. They fly into Dubai and then pick up an Emirates flight that's direct into Newcastle. There's also very good connectivity in terms of the train between all the major cities in the UK, and there's some times there for connectivity between Edinburgh, Manchester and London. In terms of getting around in the city itself, the city fortunately has its own light rail system, which is known as the metro, and the metro is equivalent to the underground system in London, and it serves a lot of the city and the wider region. So you can easily access the city using the metro system. This just gives you an overview of the full extent of the route. So in the centre of the screen is Newcastle city centre, where the main city campus is, and students tend to live further out of the city centre in some cases. So, for example, you can see on that map Jesmond. Jesmond is a very popular student area, and it's only really 2 stops on the metro to the centre of the city, where the main campus is. So, in terms of the city itself, as I said, it is the regional capital of the northeast of England. It's one of the largest cities in the United Kingdom, and it has a very diverse population, and it has quite a diverse history. So Newcastle upon Tyne was founded originally by the Romans. So we're going back a very long time indeed to the original settling of the city. And it was settled on the banks of the River Tyne. So the image in the bottom right-hand corner of that screen shows one of the bridges across the River Tyne. And on the far side of the river, so behind that picture of the bridge, you can see the big silver dome. That's a big regional arts and culture centre that has lots of popular sort of events running, lots of different types of things, music, theatre, productions, all sorts of things take place in that centre. In the top left-hand corner of the screen actually is another theatre. So that is one of the oldest theatres in England, that is called the Theatre Royal. And again, that has lots of productions that come sometimes from London, come up to the Theatre Royal. In the top right-hand corner, we have an image of part of the city centre. And you can see that Some of the architecture in the city is really quite old, so there's a lot of historical buildings in the city. As I said, the actual overall history of Newcastle upon Tyne spans a long period of history, right from the Roman period right up through the Industrial Revolution, and everything that took place in the UK. And the bottom left is just a shot of, again, another part of the city. So this is quite a historic market that is in the city. It's a covered market, as you can see, and there's all sorts of stalls in there selling a whole raft of different commodities. If we think about the wider region itself, we are very fortunate here in the northeast of England to be close to some remarkable history, and there is some amazing scenery and history very close to the city. So on the bottom left of that image, those of you who might be fans of the Harry Potter series of books and films, Alnwick Castle was where a lot of the Harry Potter films were shot. So that is a large castle that is in a town called Alnwick. It's approximately 1 hour on the bus to go from Newcastle to Alnwick. And you can visit the castle. It's open to the public, and it's quite worth a visit. In the centre, we have Hadrian's Wall. So I mentioned that the city was originally settled by the Romans, and Hadrian was a Roman emperor, and Hadrian built a wall that spans the entire length of England. So he built a wall as a border between Scotland and England, and so it was a very substantial fortification. And large parts of that wall still exist, and some of the original hill forts still exist. So you can go and visit that very easily. Again, it's pretty accessible in terms of public transport. And then in the right-hand side, we have probably one of the most spectacular castles in Northumberland, and that is Bamburgh Castle. And you can see that it's perched high on that rocky outcrop. And what you can't quite see in that image is it has a view of some really rather spectacular beaches that are around the castle, and the castle really dominates that scene for many miles around. So that is again open to the public. Definitely something thinking about visiting. Very impressive views from the castle. So basically, Newcastle, as I say, it is a large city on the banks of the River Tyne. So that's the river we can see. We have the Tyne Bridge in the foreground, and in the back of that picture is another one of the bridges across the Tyne. And what we have on either bank of the river is we have the city on the left-hand side, and on the right-hand side we have that cultural centre I mentioned earlier on. So in terms of living in Newcastle, Newcastle is definitely one of the more student-friendly cities, not least because it is one of the most affordable cities in the UK to live as a student. But also the students make up quite a large component of the population of the city. The city is quite a diverse population. It is a very open and accessible city, so it is quite common for members of the public to strike up conversations with people at the bus stop. So it's quite a friendly, open city. And you know, I might be slightly biased because I'm from the Newcastle, but actually the further north you go in the United Kingdom, it tends to be more friendly in terms of the way people interact with each other. So we have a campus that is right in the centre of the city, and the campus is what's called a red brick university. So that is the category of university that Newcastle is. You can see that originally the university was established in 1834, and the images we have on the screen reflect some of the buildings, some of the very early buildings that were built as part of the university. And that image in the center is one view of what's called the quad. And the quad is the very center of the campus. And basically it's a large square with an open grassed area, and all the buildings that make up that square are all very similar to the one we see in the image. So they're all some of the oldest buildings on campus. They're all from the very early part of the building of the university. So also as part of the city centre campus, there has been a significant period of regeneration. So the university has invested quite heavily in some new buildings on the campus. And this bit of the campus is approximately 10 minutes walk from the main central point of the campus. And some of the buildings we can see there in the top right, we have the Urban Sciences building, which is actually the home to the School of Computing. And just adjacent to that building in that image is the Frederick Douglass Teaching Centre. So that's a very large multi-purpose teaching centre. And then on the bottom right, we have something called the Helix, and that is owned by the university, and that houses some of the UK's national centres of excellence. So, for example, the National Centre for Big Data is housed in that region of the campus. So there's a lot of high-tech and science-based activities on that part of the campus. So this image just gives a bit of an overview of Newcastle upon Tyne. So we can see on the left-hand side Central Station. So that's the main rail station. So if you travelled by train, say from London or Manchester, that's where you would get off the train. We can see the Helix, which we just talked about, and the business school, and they are adjacent to a region called Chinatown. So Chinatown, as the name suggests, is a large concentration of Chinese restaurants, Chinese supermarkets, all sorts of things of that nature are based there in Chinatown. Then over at the top of the image, we can see the football stadium. And I don't know if some of you on the call follow football and maybe are interested in the Premier League, but that is the stadium. That's the home of Newcastle United. So I must confess, I'm not a huge football fan, but it is rather popular in this part of the United Kingdom, and that's the home of Newcastle United. And then on the right, we can see the main shopping area in the city, and just immediately adjacent to that is the main campus. So that is where the School of Pharmacy is based. So as a university, as an institution, we have an outstanding global reputation. So we are in the top 110 universities in the world, and we have a 5-star QS ranking for excellence. So if you joined us at Newcastle, you would be joining a university of significant global standing. So we have a very good reputation as an institution. So we have over 120 nationalities represented at the university. 5,000 international students are studying at the university with campuses in Newcastle. So Newcastle is our main campus, but we have a campus in Malaysia and Singapore. Pharmacy, if you wanted to do pharmacy, that is on the Newcastle campus only. Excuse me. And 25% of the university staff come from outside of the United Kingdom. So in terms of academic excellence, we have a structure that is comprised of 3 faculties that are then made up from 19 different schools. And I guess the faculty we're perhaps more interested in is the medical sciences faculty. So within the Faculty of Medical Sciences, we can see the schools that are represented. So we have biomedical sciences, which includes nutrition, dietetics, subjects like that. We then have dental sciences, so there's a large dental school, there's a very large school of medicine, and obviously the School of Pharmacy, which is what I'm here to talk about, and then there's also a School of Psychology housed within that faculty. So the last little bit of my talk, I'm going to focus on the pharmacy program itself. So I guess first question is, well, why might we want to study pharmacy? And I guess one of the things that's particularly relevant in the United Kingdom context, but it's also something that is happening internationally, is the role of pharmacists is changing quite significantly. And one area where the role has changed the most is in hospital pharmacy. So just as in medicine, where we see there are clinical specialisms, so you would have doctors that concentrate on oncology, infectious diseases, etc. We now see the same roles for pharmacists. So you would have pharmacists that specialize in oncology, pharmacists that specialize in infectious diseases. So those are much more prominent roles now that pharmacists are taking within hospital settings. Also, community pharmacy has seen very significant change in the UK. So, for example, within a community pharmacy setting, there are certain healthcare screening programs that are run now by pharmacists, including vaccinations. There is also sexual health screening programs. Pharmacists now are also in community managing certain minor ailments. So, for example, they might manage a patient that has shingles. So there's a wider role there in the community setting as well. And I guess a final thing just to say on this slide is pharmacy is still quite unique in many regards because there is a very solid core of science, and then there is also the clinical skills and the clinical science. So what that means is if you decided that actually you didn't want a role that was patient-facing, you wanted to go into the pharmaceutical industry, you still can do that with a pharmacy degree. That is still an option for pharmacy graduates. So I guess what we're seeing is that pharmacists are dealing with real-life problems. So probably most notable, pharmacists are involved in the management of medicine. So the safe supply of medicines, they're making sure that medicines are effective and appropriate. That is still a very core feature of a pharmacist role. But we can see some of the other areas where pharmacists are heavily involved. So this slide really is just to provide a quick overview of what makes pharmacy at Newcastle special. Why would you consider Newcastle University to study pharmacy? And without doubt, we are probably one of the most forward-looking schools of pharmacy in the UK in terms of how we provide clinical training to our students. We have a policy here at Newcastle that is to use real environments to deliver clinical training. So very little of our training is simulated. So what we have is we have a program of clinical training that is based on the wards in the two hospitals. So Newcastle has two large tertiary care hospitals. So these are hospitals that are centres of regional excellence. On the top right of the image, we have the Royal Victoria Infirmary, and that has the regional trauma centre. It has various other regional specialisms based there. And you might have, earlier in my talk, you might have heard a siren going. So that was an ambulance passing, and that's because the School of Pharmacy is opposite the Royal Victoria Infirmary. So we are literally right next door to that large hospital. And then the bottom image is another hospital in the region, which is about 2 miles outside of the city centre. And that's a hospital called the Freeman Hospital, and that is the regional transplant centre. So again, lots of specialisms that are based there at a regional level. We also, as a school, we run our own clinics. So we actually run what's called Healthy Heart clinics in partnership with the City Council. These clinics allow students to practice being a pharmacist. So the clinics are run by students. It allows members of the public to come to the clinic without an appointment, and they can be assessed for certain conditions. So, for example, as the name implies, the Healthy Heart Clinic is where students can interact with patients around cardiovascular risk. So students can measure blood glucose, they can measure blood cholesterol, they can take blood pressure, they can do body mass index. So there are all sorts of things like that that the students are actually doing with members of the public. And then finally, we also have partnerships with a local chain of pharmacy shops called Well Pharmacy, and also a general practice hub. And through those two partnerships, we have students based in the GP surgery, but also going out on specialist buses that Well Pharmacy run, in which they go out and they deliver services to patients. So in terms of what does the curriculum look like? Well, at Newcastle, we operate what's called an integrated curriculum. So you might be currently studying, say, chemistry as a subject, biology as a subject, and that's fine, and that's what most of our applicants would be doing. But rather than have those separate subjects, once you leave stage 1 of the degree, so in stage 2, 3, and 4, we have what's called integrated concepts. And essentially what that means is we have teaching around body systems. So for example, at stage 2, you would get taught about the cardiovascular system. So you will get taught normal physiology, diseased physiology, and then all the therapeutic interventions that go with it. We also operate what's called a spiral curriculum. Very simply put, what that means is in year 1, we'll introduce some basic concepts, and then in year 2, 3, and 4, we will revisit the concept and just add a little bit more complexity to that concept as we go up through the degree. And by the time you get to year 4, students are able to actually completely undertake the task at hand. In terms of the degree structure, what you can see is that we have large single modules in stages 1 to 3, and then in stage 4, we have 2 modules. One is worth 75 credits, which is really very specialist pharmacy provision, and the other one is a research project. So a typical week for pharmacy students, so the total number of hours of teaching will vary each week, but it will be around 20 to 25 hours of contact teaching. So that's where you're in a classroom and there is a lecturer, and there'll be different types of sessions. So you can see you will receive lectures, you will have laboratory classes, you will have seminars, you will have tutorials. This slide just really sets out something called interprofessional education. So in other words, you will get some teaching that will be joint with medical students. You will get some teaching that will be joint with dental students. So during your 4 years on the degree, there will be some sessions that will be what's called co-taught with students from other subjects. And we can see on the slide some of the subjects where we're currently delivering some of that teaching. So I mentioned that one of the things that makes Newcastle special for pharmacy is our clinical training, what we would call experiential learning. So in other words, it's the business of being a pharmacist. You can see that at stage 1, we have a ward-based program. So that's between the 2 hospitals that I explained earlier. And it is small group teaching around particular competences that we would expect from a pharmacist. And once the students have gained those skills and have been signed off by their tutor as being competent, then the students work independently on the hospital wards around admission of new patients to the wards. At stage 2, we have the clinics I talked about. So those are the clinics where students run services for members of the public. And we have a number of those clinics operating across the city. So students get experience in that setting. And we also have students going out on one of the buses that Well Pharmacy has. So Well Pharmacy has a number of buses that they use to deliver pharmacy services to regions of the city where they might have populations that don't access healthcare very well, and sometimes the buses will go out into rural Northumberland and deliver services there, and the students take part in that as well. Stage 3 is around small group teaching, again on the wards in the 2 hospitals, and this time it's centered around the patients being discharged and sent home. So really it's around students making sure that the patients understand the medicines they've been given, understand how to use the medicines, understand what sort of side effects they might experience and what to do if they experience those side effects. So it's all really around discharge of patients. And then at stage 4, we have that module, which is very specialist pharmacy provision. And the students at stage 4, again, they work with specialist providers. So they have some experience with a local GP practice. And as part of that process, the students are taught how to deliver vaccines. So students take part in vaccination programs as well at stage 4. Also at stage 4, we have specialist mental health provision. Students also have an option at stage 4 to go and experience pediatric pharmacy. So also in the city is a hospital called the Great North Children's Hospital, and that's a specialist pediatric hospital, and students get the opportunity to get some experience in that hospital as well. In terms of if you wanted to undertake a clinical training year in the UK, then as a school, we can provide students with help and support. The process is called ORIAL, so it's an ORIAL selection process. So that's something students do if they want to complete their clinical training year in the UK. So the way the system works in the UK is students do a 4-year MPharm degree. Then they do a year's clinical training. At the end of that clinical training year, they sit what's called a registration assessment. So in other words, the regulatory body, which is called the General Pharmaceutical Council of Great Britain, they every year run an examination, and at the end of that clinical training year, students sit the examination, and if they pass the exam, they become a registered pharmacist, and they can then work anywhere in the UK as a pharmacist. So that training year, finding places in that training year is run through a scheme called ORIAL. And as a school, we provide a lot of support to our students to help them navigate that ORIAL selection process. And historically, our students have done very well in the ORIAL selection process. So it's very typical for our students to get their first choice training place, which quite often is a training place in a hospital. So research, there is a lot of research in the Faculty of Medical Sciences, too much really to put on the one slide. So I've just picked some of the more popular areas, and by popular, I mean areas where pharmacy students have gone to do their final year project. So when you get to stage 4, you can pick a project and you can do a piece of research, and these are some of the areas where our students have gone in the past. In terms of support for students in the school, it's split into 3 main areas. So you will be assigned a personal tutor, that is a member of academic staff, and that personal tutor will really be there to support you for the 4 years of your degree. So that's the person that can help you fill in the right paperwork if you need to, can help with academic matters, any sort of thing that might be causing a student a problem, then the personal tutor can help. In charge of the personal tutor system is the senior tutor. In this school, that is Dr. Laura Lindsay. And then each year of the program, so year 1, 2, 3, and 4, has what's called a stage lead. I am the stage lead for stage 1, and I offer various support sessions that students can come and see me and talk about any particular issues they may be having. There is a lot of support available from the Central University, so lots of support there. So if students may have some health issues and may need support with those, that support is provided by the Central University. And then finally, the student body. So in the School of Pharmacy, there is a very active student society, which is called PharmSoc. And PharmSoc offer lots of different things. So they run sports competitions, they run a summer ball and a winter ball, they run support sessions for new students to help new students settle in. So they do all sorts of things within the School of Pharmacy. So that's definitely something to think about if you come to Newcastle. In terms of entry requirements, I guess probably the things I really need to draw your attention to is in terms of South Korea, it would be case-by-case basis, but essentially you can see the requirement there. It's typically 90% in the junior diploma. We also have a requirement that is called fitness to practice. To be fair, you will have to do fitness to practice whichever School of Pharmacy you go to. Fitness to practice is made up of 2 sections. One is a health assessment. So, you know, just to make sure that you are able to undertake the role. And the other component of fitness to practice is around a police check. And obviously both of those requirements relate to the fact that you're going to be working with members of the public, you're potentially going to be working with vulnerable patients, and therefore that requirement is present whichever School of Pharmacy you ultimately go to. Final thing to say really is that for entry in September 2025, we will be introducing an interview component. The interview component will be made up from your personal statement and your motivation to do pharmacy. So that will be the questions you will get in the interview, something about your personal statement and something about why you want to be a pharmacist. The interviews will be conducted via Zoom, so there's no need to be in person in Newcastle. Interviews will be conducted via Zoom. The interview will be conducted by a member of academic staff and a current pharmacy student. So that's how the interviews will be run. Applicants will be able to select a date and a time that is convenient for them in terms of the interview. And I'm conscious of the time. I'm running slightly over time. In terms of estimated monthly budget, I've just taken these figures from the university's website, so they are available via the website. But what you can see is it is relatively inexpensive in terms of cities in the United Kingdom. So just to finish, there is information on the website and I've put a link there. As I said, I am the admissions tutor and my email address is available there on that slide. If you would like to get in touch with me for more information, then please do drop me an email. I will stop sharing my screen and really if there are any questions, then I'm very happy to answer any questions.
Thank you for your presentation. 혹시 교수님한테 질문하시고 싶은 질문이 있으실까요? 영어가 조금 어려우시면은 UK 에듀센터 쪽으로 메시지 주시면은 제가 통역해서 질문을 드리고 답변도 통역을 해드리도록 하겠습니다.
Hi, may I ask a question?
예.
Yes, sure.
Hi, Mark. I'm Rachel. Thank you for the very comprehensive presentation. I just want to know a little bit more about the interview. What will you focus on? What are you looking for from the students who are in the interview, and what are the potential topics you will talk about during the interview? Thank you.
Thank you. That's a good question. So, the requirement to interview. So, I should maybe start by saying, for entry now, we don't interview. However, the regulator has said that all schools of pharmacy now need to interview applicants. So what we are going to do for our interview process is we are going to focus our discussion on the personal statements for the applicant. So the applicant will apply through UCAS and they will write a personal statement. So we will be talking about their particular personal statement. And we will also be asking the student, why do they want to study pharmacy? What is it about pharmacy that makes them want to do the subject? Those are the two areas that we will really be focusing on.
There is no mathematical question or any behavior test regarding the scenario, so no.
No, it will be nothing other than a conversation about personal statement and why.
뉴캐슬대학교가 원래 인터뷰가 없는 유일한 약대였어요. 근데 아까 제가 채팅으로 쳐드린 것처럼 2025년도부터는 인터뷰를 진행을 할 건데, 이게 사실 학교가 원하는 게 아니라 이제 약대 영국 정책상 약대들에서 모두 인터뷰를 진행을 해야 된다라고 해서 학교에서 지금 이제 인터뷰를 진행을 하려고 하고, 대신 아까 다른 프레젠테이션 학교들과 다르게 자기소개서, 퍼스널 스테이트먼트라던가 아니면은 모티베이션, 왜 약사가 되려고 하는지 이런 거에 대한 질문을 한다고 합니다. 뭐 수학 질문이라던가 뭐 윤리적인 질문 이런 거는 따로 없다고 합니다.
One last question, sorry. A follow-up one. You said there's no interview at this moment. Does it mean there's no interview for 2024 entry, but for 25 entry student there will be?
That's correct, yes.
Okay, thank you very much.
No problem, thank you.
So I think there is no more questions so far from the audience. So Mark, you can leave the session now.
Okay, that's the end of session. We can leave.
Yeah,
that's the end of the session. Okay, thank you very much. I appreciate the opportunity to have a chat to everyone.
Thank you for attending our session.
Thank you.
Take care. Bye.
Bye.
Rachel, you can leave as well. Yeah, okay. 네, 오늘 참가해 주셔서 감사하고요. 여기까지 오늘 저희가 준비한 이제 교수님들 세미나였고요. 조금 긴 시간, 한 2시간 정도 진행됐는데 긴 시간 동안 들으시느라 고생 많으셨습니다.